morning, Warden Gutowski and council members. My name is Shauna Dunn. I'll be speaking on behalf of OPSEU Local 462, representing 129 paramedics who work for Frontenac County, with concerns related to the reduction in ambulance services slated for May 20th. Firstly, I would like to express our thanks to the CAO, Elizabeth Seville, for the short notice approval of this deputation. We appreciate the opportunity to address council on this matter. As paramedics, we are taught to advocate for our patients to ensure that they receive the best possible care. This is the reason for our presence here today. We are here to advocate for the residents of Frontenac County and the city of Kingston, our future patients. Some may view the slogan on our t-shirts, "Cuts to your ambulance service can cost you your life," as a simplistic analysis of the issue, or perhaps even as a scare tactic. Reality is that people don't care about an issue until it affects them personally. So by using this slogan, we hope to help people make the connection between the reduction of ambulance resources and the personal impact it could have. The gravity of this issue cannot be overstated. Incidents involving delayed ambulance responses and the corresponding delays in transporting patients to the hospital are occurring more and more frequently across this province. As the demands on our healthcare system steadily increase, specifically in connection with the aging baby boomer population, this problem is only going to worsen. A news report on April 12th described an incident in Toronto that occurred on January 30th, where a man with a badly broken leg waited outside in the cold and in pain for almost an hour before an ambulance was available. Another incident in Toronto that occurred on December 30th, 2012, actually resulted in the death of an elderly woman who waited more than 3 hours for an ambulance. Now, before you start thinking, well, that's Toronto, that won't happen here. Let me provide you with an example a little closer to home. On March 22nd, 2013, the Brockville Reporter-Times reported on an incident that occurred on February of this year, where a 911 call was placed about a patient who was not breathing and who did not have a pulse. It was 22 minutes before an ambulance arrived. Unfortunately, but not surprising given that time frame, resuscitation attempts were unsuccessful. The death of this Brockville resident prompted the coroner to recommend a review of Leeds and Grenville EMS to prevent this type of incident from happening again. In a CBC News article in February regarding the death of that elderly Toronto woman I mentioned earlier, Chief Charbonneau himself is paraphrased as saying that innovative solutions and strategies are needed as emergency medical services across the country are facing growing demands. He is then quoted as saying, "We're beginning to hit the beginning of the tsunami, and we know it's coming, and we have to prepare for it. There are pressures on the system. There are needs for strategies in every province on how to deal with the increase." End quote. It seems odd that a chief would make these statements only to turn around a few months later and seemingly support cuts to their own service. The section of the 2013 draft budget pertaining to the ambulance service contains various statistics and graphs which provide evidence that the demand for emergency medical services in Frontenac County and the city of Kingston has been increasing by almost 12% year over year since 2009. This section also speaks to the pressures of the coming population tsunami and the strain this will place on our current resources. So again, how does cutting an ambulance coincide with the growing demands described in the draft budget? The tsunami is the aging or gray tsunami, which is a demographic trend related to the baby boomer generation. Statistics Canada reported a 14.1% increase in people aged 65 and older between 2006 and 2011, for a total of almost 5 million senior citizens. Health Canada projects that by 2021, the senior population will rise to 6.7 million, and by 2041, this number will be 9.2 million. You do not need to be a statistician to realize that an elderly population of that size will place enormous pressures on our economy and our healthcare system, including emergency medical services. This looming reality speaks to the need for a long-term and sustainable plan for delivering effective emergency medical services for our community. Quote, "The County of Frontenac's mission is the effective, efficient, and sustainable delivery of services to citizens," end quote. The policy document, Directions for Our Future, also states that, quote, "Frontenac residents and stakeholders continually share their beliefs about a sustainable future," end quote. These statements would suggest that Frontenac County is committed to operating under the principle of sustainability. At first glance, cutting an ambulance to save money might appear to be keeping within this principle of sustainability in terms of balancing current fiscal constraints. But what justification was there to cut an ambulance in the city of Kingston and from the base that responds to the most emergency calls each year? Was it because of the belief that only the service in Kingston would be affected? That the county ambulances serving your electorate would remain unaffected? The ambulances stationed in Snow Road, Parham, and Sydenham will undoubtedly have to provide emergency standby coverage and respond to emergency calls in and around Kingston even more frequently than they do now, thereby subjecting county residents to even longer response times than they're used to. Ultimately, the elimination of one ambulance in Kingston will affect everyone in Frontenac County, not just city residents. We think the public would agree that it is one thing to have to wait for an ambulance when that resource has never been there, but it's another thing to have to wait for an ambulance because EMS managers and county council took that resource away to balance their books. Overall, this decision to cut ambulance resources seems to lack foresight in terms of the impacts to patient outcomes, paramedic workload, and long-term provision of effective, efficient, and sustainable emergency medical services for our residents. The assurances made to the public by Chief Charbonneau that the ambulance service will continue to meet the established response time standards is of little consolation. Ontario EMS providers were mandated to establish these standards for themselves last fall for implementation on January 1st. But it seems the bar has been set at a rather low level to avoid any chance of failure. For instance, in the case of a sudden cardiac arrest, the County of Frontenac response time standard endeavors to have a responder, and not necessarily a paramedic, on scene with a defibrillator in 6 minutes, 48% of the time. Given that Frontenac Paramedic Services mission states that, quote, "It will deliver excellent service to our communities," the endeavoring to achieve something only 48% of the time does not seem like we're striving for excellence. When you consider that the Heart and Stroke Foundation states, quote, "For every minute that passes without help, the chance of surviving drops by about 10%, end quote. This means that if your heart stops and you drop dead in Frontenac County, you will only have about a 40% chance of survival, 48% of the time. That doesn't seem like excellent, does it? If your child is choking and turning blue, or if you find your wife unconscious on the bathroom floor, or your husband has cut off his arm and blood is spurting everywhere, the response time standard states that 68% of the time, the County of Frontenac will try to have a paramedic on scene within 8 minutes. Can you imagine how long 8 minutes feels when you're waiting for an ambulance to arrive in any of those scenarios? And what if your call for help falls into the other 32%? How long will you have to wait then, and with what outcome?
Just like to advise you that the delegation length is 15 minutes and your time is about up. Thank you.
9 minutes.
I have about another page and a half to read. We as paramedics have serious concerns about the implications of the various budget mitigation strategies presented to Council for the 2013 budget. The elimination of one ambulance and 4 full-time paramedic positions is a particular concern, given the direct impact on the frontline emergency medical service resources. Of course, the actual effect that these cuts will have on our patients is unknown as of yet. That is because most, if not all, of the ambulance services in this province have been advocating for enhancements to their services, not reductions. Frontenac County will thus have the dubious honor of leading the way in discovering the true cost of cutting ambulance resources in the face of a rapidly aging population, increased demand for emergency medical services, and the impending crisis on our healthcare system as a whole. It is our belief that other areas of the ambulance budget could have been trimmed without reducing frontline ambulance resources and the corresponding level of service that we provide to our patients. And even if there were no cost savings to be found elsewhere, we suspect that the taxpayers of Frontenac County and the City of Kingston would support a modest tax increase to maintain the current level of ambulance services. Regrettably, the public and other stakeholders were not given the opportunity to participate in making this decision. This fact, too, is especially concerning given the county's own accountability and transparency policy, which states that accountability, quote, is the principle that the county will be responsible to its stakeholders for decisions made and policies implemented, as well as actions or inactions, end quote. And transparency is, quote, the principle that the county actively encourages and fosters stakeholder participation and openness in its decision-making processes. Additionally, transparency means that the county's decision-making process is open and clear to the public, end quote. This policy further states that, quote, the Council of the County of Frontenac acknowledges that it is responsible to provide good government for its stakeholders in an accountable and transparent manner by encouraging public access and participation to ensure that its decision-making is responsive to the needs of its constituents and receptive to their opinions, end quote. Therefore, we believe that the decision to cut an ambulance as a cost-savings measure is contrary to many of the county's own policies and guiding principles. Based on the information we have presented today, it is our position that this decision is not only inconsistent with public expectations for emergency medical services in the City of Kingston and the County of Frontenac, but it sets a very negative precedent for other ambulance services across Ontario. It is not in the best interests of our patients, who will likely face longer response times and delayed transport to the hospital, and it fails to address the imminent need for long-term EMS planning as the demand for emergency medical services continues to increase, especially with our rapidly aging population. We, OPSEU Local 462 paramedics, will work tirelessly to advocate for our patients on this issue. We strongly urge Council to reconsider this decision and act in the best interests of the residents of our community. Cutting an ambulance in light of current and especially future demands is not in anyone's best interest. After all,
May I ask, is your presentation almost complete?
I have one more sentence.
Thank you.
After all, it could cost you your life.
Thank you for your presentation. Discussion, members of council, questions? We do have a resolution.
Moved by Councillor Doyle, second by Councillor John, resolved that the Council of the County of Frontenac receive for information the presentation by Ms. Shauna Dunn, OPSEU Local 462 Chief Steward, providing an overview of the effect that cuts to the ambulance service will have on the citizens of Kingston and the County of Frontenac.
All in favor? Carried.